Well, if Cole's talk was about the future, the present and the future, mine is a little more about the past, but maybe with some hints to what might happen in the future. Here is a modern hospital, as envisaged in Lego, and it's a good representation. I'm going to show that in juxtaposition. It's a shame I didn't show these on the same slide, actually, but there you go. You have the hospital in the background, and you have Lego. There it is. It stands on its own. It's a kind of hyper-modern structure. It has ramps. It has vehicular access. It has a sick person on the floor outside, and a helicopter, of course, because it's extremely high-tech, extremely expensive. It has some trees for appearance sake, but there is the modern hospital, and there it is again, as you see it emerging from the roof of the Maggie Centre, as we see outside. It's a kind of hyper-modern structure, the apex of modernism. And it was designed by Ralph Tubbs, this building, who designed the Dome of Discovery at the Festival of Britain. So it has a kind of darker version of that idealistic utopian modernism in it. Now, I don't think it's saying anything too controversial to suggest that something's gone rather wrong with the architecture of hospitals when we look at this here. And in fact, the PFI buildings that we're surrounded with, it's become a kind of industrial architecture, a Fordist factory for procedures. The modernists, of course, famously separated everything out. They had diagrams. They designated separate zones for living, for working, for industrial production, for health. And like the idealized industrial units that these have become, hospitals were separated out too, shoved out into the suburbs where land was cheaper, where parking was plentiful, where big, hideous buildings could be easily built without objections from the planning authorities. What a way to treat the sick, to treat people who are dying, to treat their families. Now, when we think of the Middle Ages in contrast to Fulham Palace Road, when we think of a medieval hospital, we might think of plague and pestilence, we might think of mendicants and leeches, but the medieval hospital was actually a key building in the heart of the city. The word's roots are famously in the idea of hospitality, just as those of the hotel. And the church and the cathedral may have been the symbol of the city, the spire being a kind of cipher for aspirations towards heaven. But the hospital was the symbol of the city's civic kindness, of earthly mercy. You could argue that in the hospital, the city showed its true face in its provision for the sick, for pilgrims, for travellers, for the dying and the poor. The civitas displayed its civility. At least partly inspired by the Islamic bimaristans the Crusaders saw in their travels around the Middle East. The hospitals, the Middle Eastern hospitals, with their courtyards and their shaded arcades, with their architecture as a vision of an earthly paradise. The medieval institutions that were built here began to illustrate the idea of a hospital as the merciful heart of the city. I'm just going to flip through a few of these just to give you an idea of the bimaristans of the Middle East. So these were hospitals that took architecture seriously. And then back to Beaune, which Charles has already shown us. It's not just a hospital, but it's a settlement. It's still producing fine wines. It's still a productive part of the city. There was in Lyon the Hôtel Dieu, where François Rabelais became a doctor and at the same time wrote his satires. There's St. Cross in Winchester, where visitors are still entitled to a small mug of beer and a hunk of bread. And at the Royal Naval Hospital in Greenwich, by the way, which I'll show a slide of in a moment, had a brewery on site. And beer was piped directly into the wards. There were little taps in each ward. So like Beaune, these hospitals were places of production they weren't monocultures. They were in fact mini cities. Now, as things moved from the medieval to the Renaissance eras, it isn't too much of a stretch to argue that the hospital, in fact, becomes the key building type of the city and of the era. It's a semi-secular civic landmark which balances the mass and the awe of the church with its elegant courtyard, a kind of terrestrial counterbalance to the dome as the representation of the vaults of heaven. One represents humility and mercy today, the other redemption tomorrow. Brunelleschi's Ospedale degli Innocenti in Florence was the first perfect building of the Renaissance. Its arcaded courtyard forms one of the city's key civic spaces, whilst Filaretti's Ospedale della Maggiore in Milan developed Brunelleschi's arcading to create Lombardy's first kind of perfect Renaissance structure. In Spain, the Hospital de la Santa Cruz in Toledo reaches an incredible level of civilized hospital design based in a tradition of providing hospitality for pilgrims en route to Santiago de Compostela, as well as for the poor and the sick who pass through. This is a building which sits somewhere between a hospital, a hotel, and a civic palace, a palace for the city, for the citizens. This tradition continues into the Baroque and the Enlightenment with Les Invalides in Paris, with the Royal Hospital in Greenwich with its beer taps, and the Chelsea Hospital nearby, both by Christopher Wren. Now, all these buildings with their big domes are symbols of power as well as of mercy. Les Invalides is an expression of Louis XVI's Paris as the successor city to Rome. Its dome is a riposte to St. Peter's, whilst the London hospitals are effectively military monuments, both in answer to Paris and as an architectural attempt to assert military presence over the city. But despite their conception as ciphers for military might, they're also incredible and generous public civic markers and monuments. Very, very generous spaces in the city. Now, right through the ensuing centuries, the hospital remains an absolutely pivotal element in the city and urban architecture. If we just look at London, there's Bart's here, set at the centre of the city, right opposite the shambles of the meat market in Smithfield, which was also a place of public execution, and absolutely a visceral reminder of the juxtaposition of mortality and mercy. And it's also, of course, a beautiful building right in the midst of the gritty city. Now, if Parliament was regarded as at least as filthy a place as the meat market, then it too had its antidote over the river in St. Thomas's. Built as a series of pavilions along the river in order to flush out the miasma and the foul air, partly inspired by Florence Nightingale's researches in the Crimea. Again, it's an absolutely key structure. It's effectively a riposte to Parliament over the river. It's a kind of it's not quite as Gothic, but it's a big. Here is the civic side of the city, and here is the caring side of the city, facing each other on the Thames. This is an earlier incarnation on the right there with the courtyards. Again, it's actually, although the pavilion plan was a 19th century invention, it's quite it seems to reach back further in this series of courtyards, series of gardens and open spaces. Now, after all that, try to think of a hospital or a health building anywhere in the world, well, except Holland, which you could say truly is in the vanguard of architectural thought, or which is beautiful. I can't think of one, of course, excepting Holland, as I've said. Healthcare has been relegated to the service sector. Yet this denial of the importance of the hospital as a key figure in the city exactly coincides with what Charles refers to as a kind of medicalization of our lives. Births and deaths occur not at home, but in the neutral, sterile surroundings of the hospital, beneath the flickering fluorescent lights, bleak corridors, or behind plastic curtains. As we age as a population, as drugs get better at holding death away, we'll all spend more of our lives in hospital, yet they remain the most disheartening of all building types, designed seemingly to make us want to get better just so that we can get out. The Maggie centres are not hospitals. They don't face, which are what I'm now told by Cor Wagner, are not unimaginably complex technical demands that hospitals do. Yet I do think that they do reveal something important about the significance of architecture, about the potential of a beautiful building.